Hello, guys. So, welcome back with some respiratory scenarios. First of all, we will discuss about cough. So, cough can be present with like respiratory problems, or it can also be a presenting symptom of some cardiac problems as well. So, first of all, we will discuss some respiratory problems. But wherever you have cough, just remember that whenever the patient presents with cough and the presenting complaint is cough, you need to ask a few questions because whenever you follow Odipara, it takes a lot of time, and in respiratory symptoms, you have a lot of data gathering. You cannot miss anything from Maftosa. I will tell you in a moment. So just remember that you need to ask these couple of questions, these 3-4 questions that will cover all your Odipara. So whenever the patient present with any presenting complaint, you ask an open question. Can you tell me a bit more about it? So it's a quite outdated question. You can just add because patient wants to know why you're asking about it. So just to get a better marks, you can say, can you tell me a bit more about it so that I have a better idea of what's going on? All right. So the patient will tell you, Doctor, I have cough for 2 months, Doctor, I have cough for a few weeks. So mostly the doctors, they get the answer of only the duration for how long this cough has been going on. Or sometimes when the patient is a bit stubborn, they can say you, what do you want to know? They didn't tell you anything. All right. So you can start with, since when you are having this cough? All right. First of all, you need to ask about the duration, like for how long he has been going through this cough. All right. And then you need to ask about the continuity. You can say duration, like, do you have this cough all the time or is it on and off? Then you can ask about any aggravating factor. Is there anything that makes this cough worse? Then for relieving factor, just to make a better sentence, you can ask, I can understand that you're having this cough for 2 months. When it's chronic, then you can say, I can understand that you're having this cough for 2 months. How are you coping with it? All right. And if it's acute, like the patient is having cough for 1 week, 2 week, then in simple way you can ask, have you tried anything for this cough before? Maybe he has tried some syrups, some antitussives. They will tell you that, yes, doctor, I have tried this. All right. And then always ask about phlegm. So sputum is a medical term. So ask about phlegm. Is there any phlegm with it? If yes, then it is productive cough. So you need to ask about the phlegm. How much phlegm did you cough up? All right. You can ask about the color of the phlegm. You can ask about any change in color of the phlegm. All right. And if there is no phlegm, then it's simple. You can say, did you notice any blood? Even make it simple. All right. When you have phlegm and when you don't have phlegm, it's compulsory that you need to ask about, do you have any blood? Did you notice any blood? Maybe he's coughing up just blood. He's not having sputum, but he's coughing up just blood. Maybe he's having lung cancer. All right. So always ask, did you notice any blood? Maybe he will say that, yes, there are some streaks of blood in my phlegm. Or he can say, yes, I am coughing blood. So you can say, how much blood did you cough up? How often did you cough up blood? Is it fresh blood? All right. So if the answer of these two questions is yes, then you can just increase your questions by asking the color, the quantity. All right. And then just a few questions regarding your general health. So make it a habit that whenever you are changing a topic, you are moving from presenting complaint to some associated symptoms. So ask just a few questions regarding your general health. How has your health been recently? It covers a lot of questions. You don't need to ask separately any fever, any flu-like illness. Mostly the patient say yes, I'm sometimes having flu, I'm feeling fever, I notice some swelling. All right, so it will cover your flaws. As I have already tell you about flaws, fever, lumps and bumps, and appetite, weight loss. All right, and whenever you have cough, remember that there are two things that are related to cough: your lungs, your heart. So you have covered a lot about your lungs. So for heart, just two questions: any heart pressing, any chest pain. All right, and then you can move to your P2. Is it the first time that you're having this cough? Have you been diagnosed with any medical condition? And ask specifically a heart or lung condition. So in P3, only smoking. All right, you can ask, do you smoke? And he says, No, doctor, I have left smoking. So ask, did you smoke previously? Yes, I am a heavy smoker. I smoked for 15 years, and then 1 year back I just quit smoking. But it is a risk factor of lung cancer. All right, whenever the patient tell you, yes, I'm not a smoker now, ask, were you a smoker previously? All right, sometimes they try to just make things difficult or trick you. All right, so it's better to ask to be on safe side. All right, and then medication, as you know, ACE inhibitors can cause dry cough, so always ask medication allergy, because sometimes they give you history of hay fever or eczema or any allergy to antibiotics, maybe from penicillin. So don't give penicillin or any antibiotic like macrolides. Avoid erythromycin, because in respiratory system all the management involves antibiotics, paracetamol, steroids, fluids. So antibiotics is must. So always rule out this allergy of antibiotics or any allergy from anything. All right, and in family, you can say like, is there anyone who has been diagnosed with any heart or lung condition? But in respiratory, it's better to ask to make family history a contact history. Anyone in your close context who has been having similar symptoms. All right, and he will say, yes, my mother is having cough as she is having TB. All right, so it will change your diagnosis. It can become tuberculosis instead of pneumonia. And then you ask about travel history. Have you traveled overseas recently? Yes, I traveled to South Africa. Yes, I traveled to South Asia. Yes, I traveled to India, and it's tuberculosis. All right, and then what do you do for living? Because there is chance of mesothelioma. He may be a coal worker, he may be a plumber or anything. All right, and then psychosocial. How has this affected your life anyway? This is IPS. All right, anything else you want to share? Ask ideas, concern, expectation. And in respiratory or in cough scenarios, in shortness of breath scenarios, always in examination say, I would like to request chest x-ray, because they have the chest x-ray, but they will not give you if you will not say. They will just give you observation findings, they will give you chest examination findings, but they will not hand over the chest x-ray until you mentioned. All right, so management is different for all the cough scenarios. We'll discuss it regarding pneumonia differently, regarding pulmonary embolism differently, but this is the general data gathering. to cover the respiratory data gathering efficiently, and you're not missing something, but you're just doing it in 4 minutes time. You're not doing whole Odipara for cough, but you're covering everything. All right. Thank you so much.